There. All right, that seemed to be equal expansion there. I'm going to take a listen to you, okay? My stethoscope is probably going to be a little bit cold on you. I'll try to warm it up a little bit. Okay. First, I'm going to listen up here. There's just actually one spot of the lung that you can hear. Take a really deep breath in through your mouth and out. All righty. And out. Okay. In. And out. Again. Okay. If you just breathe in and out through your mouth, you don't even have to exaggerate it. I think I'll be able to hear. Go ahead. Good. I'm going to circle around up under your arm and out. Okay, that's great. All right. While I'm back here, I'm gonna tap you pretty lightly on your back, and you let me know if you feel any tenderness. Okay? Any pain, tenderness? No. Okay. All right, then I'm going to move around to the front. And we're going to do something very similar on the front. Now then, we're going to do the front side. Let me just lay this down. Do you mind if we go ahead and just put your? Are you too cold or anything? Because just to get the front part of your chest, I kind of need to lay the gown down. Okay. You can, I mean, if it's bothering you there, you can do whatever you need to with your hands, okay? All right. First of all, I'm going to listen to your breathing again on the front side, and then I'm going to listen to your heart sounds. Don't think that anything's wrong. We do a lot of touching and feeling just to find some landmarks, and what else we do is we're listening in several different spots, because when we do that, we can listen to different valves, different heart valves. So don't be alarmed that I'm listening too long or anything like that. That's especially important with our moms. When you're doing that to their children, they get especially antsy, but I just didn't want you to be alarmed that I'm hearing something abnormal, okay? First, I just want to listen to your breathing. Deep breath and out. Okay. Now then, let me just kind of count a little. Okay. Okay. Right now, I'm feeling, a lot of times you can feel the heart as it's beating. And that's what I'm trying to find, is where your point of maximum impulse, we call it the PMI. And there it is right there, and that's it, just about exactly where it should be. Right. We'll do some listening now, okay? And you don't just breathe normal, okay? One more time, I'm just going to go through and listen with this, okay? Okay, that's great. I'm going to have you just lay back on the bed now. Let me move my papers out of your way. I know that's probably not very comfortable, is it?
Laying down is comfortable.
Tired of sitting up. Sorry, we put you through the meal today, haven't we?
That's fine.
Okay. You want to go ahead and
45-degree angle, you got them at. Hi, I'm Ellen Duke. I'm an RN and I'm Alyssa's examiner today. So I'm just helping her out on the cardiovascular section, a particular interest area of my own. And so during this time, what we do when someone presents to us is with any kind of cardiovascular distress, or if they're presenting for a health history, as you are today, we inspect their neck veins.
Okay.
Because they kind of give us a clue to what's going on in this ticker.
Okay.
So we have to have you at about a 45-degree angle to do that. What we do is we kind of ask you to just kind of turn your head to one side. We kind of have what we call tangential lighting, so that we can kind of look and see if we can see your neck veins. And if at a 45-degree angle we really can't see any neck veins, then we know that you probably are in good status as far as your fluid status, as far as your cardiovascular function. The neck veins that we are looking for are actually the jugular vein. It is you have external, meaning kind of on the outside, and internal jugular veins. And if they happen to be evidence, like someone that's heart is working very hard and the blood is backing up, and so it's getting up here high, then we do what we call kind of a look-see measure of their central venous pressure. Because if we draw a line from the highest level of pulsation out to here, and right here, I'm not trying to tickle you, count your ribs. You have 12, you know, and you can really tickle a little kid when you go count their ribs anyway, so that's mean. We look here, and this is called the sternal notch right here, and you can feel it on yourself. And then you go down to the top of the sternum, which is called the manubrium. In the middle of that is a notch there. Right below that notch, I can feel it on you because you have good bones. Right below it, if we actually drew a line straight down here, would lie the right atrium of your heart. So we imagine that that's where it is, because truly that's where it is.
Okay, I just want to listen to you again. I'm just listening to the heart right now. You know, the thing that I didn't do while you were sitting up is I just wanted to feel your entire chest wall just to make sure that there's no vibration. Sometimes you can actually feel the heart kind of vibrating, some turbulent blood flow. You can feel that on the outside. I didn't hear anything abnormal, but just in case, I'm just going to go ahead and do that now because I forgot to do it while you were sitting up, okay? And again, I'm going to find that PMI. It's just right there. Okay, one more time. Go back on my diaphragm side. And just breathe normally. Just listen to the heart sounds. Okay. Now then I'm going to move on down your belly and do a little pressing there, okay? First thing I'm doing is I'm just kind of looking just to see if I see any visible peristalsis, anything weird. I don't see anything bizarre with you, okay? I'm going to do this a little bit different. Normally I feel first, but with the bowel sounds, we can't do that. We need to listen first, because in hospitalized patients, we can sometimes make bowel sounds happen just by pressing around. And so then once we get to the listening part, we think everything's fine, and it may not necessarily be so. So I'm going to listen first, and then I'll do some poking, okay? Okay. You didn't eat lunch, did you?
Not
Not enough.
Not enough.
Your belly's hollering at me that it's hungry. So, have you noticed any problems as far as your bowel habits, as far as eating? You don't experience nausea or vomiting?
No.
Okay. Are you comfortable
Yes,
as far
I
as
am.
the temperature and everything? Because we could cover you back up if you need
No,
at this point. Okay. I'm going to do just a little bit of palpation on your belly. Are you hurting anywhere?
not at all.
No place at all?
No.
Okay. Now, when was your last bowel movement?
Yesterday.
Okay. Was it formed?
I really didn't look at it, so
Oh, okay.
just usually
All
I
right.
guess.
Did it seem your usual
Yeah.
pattern? There's nothing changing.
Nothing
Okay.
changed.
In order to just help me kind of get through your musculature here, I just need for you to lift up. That'll kind of help to relax, okay? And again, my hands are probably kind of cold. All right. I'm just going to do light palpation on you. We've not really encountered any problems. You're not having any problems. And, you know, the latest research shows that deep palpation can disturb things. So I'm just going to just do this light palpation, okay? I don't feel anything at all. Okay. Now, I'm just going to kind of lower your shorts just a little bit, okay? And do a little pressing here. When was the last time you voided? You urinated?
Um,
Your bladder's not full?
no.
That's basically what I want to make sure, okay? Alrighty then. Now, tell you what, I'm finished with the upper part of your body for the time being, so if you want to go ahead and put your gown back on just for your comfort there. Right now I just want to make a quick check over your pulses and take a look at your peripheral vascular system, okay? So I'm going to be touching you usually on both sides,
Okay.
but we'll talk about that in just 1 minute, okay? There you go. When your carotid pulse, it's real important that we not palpate these together.
Mm-hmm.
If we do, it can cause you to pass out. That's not necessarily good, is it?
No,
It's not a good thing. You're laying down, so it wouldn't be the worst thing in the world, but it would be good. Alrighty. Okay. I'm just going to kind of expose you for a second here. I'm going to run my hand just down the side of your shorts here. Sorry. I'm feeling for your femoral arteries right here. While I'm down there, I'm just going to go ahead and make a quick check of any lymph nodes that might be in that area that could be swollen, okay? Do you practice self-testicular exam?
yes.
Okay, good. 'Cause as you know, testicular cancer can be a big problem in the age group of 15 to 35, so that would be really important, okay? You just lift your knee up like that, okay? That's good. Okay, other side. That one is real hard for me to do together, so I'm just going to kind of compare. Okay, just going to swing down here. You can just relax your legs, feeling for the pulses here. This is your posterior tibial. I'm going to have to take off your socks too, just for a second. While I'm down here, just to include everything while we're here, because I know that your feet are kind of cold. I'm going to check a couple of things while we're here, okay? Right now I'm feeling around for your dorsalis pedis. We call them pedal pulses sometimes. And yours are nice and strong, nice and strong. Have you noticed any problems with the sensation in your feet? No? Not at all? Okay. Okay. So what happened to your toe here?
I stood.
You stubbed it? Yeah? Okay. Well, it looks like. Right now I'm pressing around. I'm just kind of seeing how fast your capillary refill time is, okay? You're kind of cool, so sometimes that makes it a little bit slower than normal, but I can see that it's pinking back up, so that's really good. While I'm down here, let me just go ahead and I want you to just kind of slightly bend your knee, and I'm going to push up like this. Do you feel any pain at all through here? Your calves are just so well developed. You can relax that again, okay? It's okay. Over here. Any pain at all right through here? That's great. Okay. I'm going to put your socks back on then, okay? And we'll move on to the musculoskeletal examination. The reason why I was doing that test on your leg is the Homan sign is what we do to test for deep vein thrombosis. People that are inactive or have sat for a long time on cross-country road trips, sometimes plane trips, they get clots that can actually turn loose and go to their brain and their lungs and cause major, major problems. So that's why I was checking your legs that way. Okay? I just want you to kind of swing your legs over and sit up in the bed. And I'm going to go ahead and do your deep tendon reflexes and test some muscle strength here, okay?
Right.
Before I do a lot of poking and prodding, I'll go ahead and do your deep tendon reflexes. You know, I haven't really looked at your extremities yet, but I want to do cap refill here too and just see if there's any. Notice you've got a tattoo there. Just going to go ahead and do an aside here, okay, about tattoos. You need to be especially careful with your tattoo parlors because that is a major way of transmitting hepatitis B, okay? So there's your lecture for today. Can't go back, but anyway. All right, I just want you to squeeze my hands really hard, okay? Good, okay. Now, I'm going to try to go ahead and get your deep tendon reflex here. Just kind of relax your arm. There you go. Let it dangle, okay? Okay. One more time. All right, saw a little jump there. Just going to have you relax right there is good. Relax your arm as much as possible, okay? Okay. There. Now then, just want you to kind of put your hands right there. That'll be fine. We'll just see if we can do this. Don't see anything. Okay. Now then, scoot forward just a hair. That jumped a little. Not as good as that other one though. That other one was better. It really was. Okay. Oh, that was good. Now then, the other thing I'm going to do while I'm down here is do something we call the Babinski reflex. And you have absolutely no response, and that's what we want. In order to do this, all you're doing is just putting a flat surface and you're just running the outer parameter there of the foot and ending at the great toe. I'm going to do it on the other side and make sure that that is normal as well. Nothing. That's great. Okay. You know what, while I'm down there, I know that looks kind of scary, okay? I want you to close your eyes and just tell me if you're feeling something and where you're feeling it, okay? Close your eyes.
On the top of my left foot,
Okay. Whereabouts?
on my second toe,
Very good. Other side.
on my right foot on the second toe.
Okay. That's good. I'll go ahead and put your socks back on one more time. Okay. While you're sitting, before we get you up, I'm going to go ahead and test some muscle strength, okay? I've already noticed that you've got well-developed